Hello, and welcome to a recording of the 2024 Rush Parkinson's Conference, which was held on September 21st this year. However, before we jump to your video, we do want to take a moment to acknowledge our sponsors, without whom none of this would have been possible. So this includes our platinum level sponsors, Broad Street, Movement Revolution, Supernus, Amneal, and Medtronic, as well as our gold level sponsors, Abbott and Kyowa Kirin. We do also want to acknowledge our nonprofit partners, including the Parkinson's Foundation, Lewy Body Dementia Association, American Parkinson's Disease Association, and Davis Phinney Foundation. And without further ado, here is your presentation.
Thank you for coming to this amazing event. So we really appreciate you, and we hope you really like it and enjoy it. You've been hearing about Parkinson's disease all day. Some of you have I've been diagnosed with the disease, so you know everything about it already. But what I would like to focus on today for a little bit is I would like to talk to you about the technology that is out there that we have currently available to help diagnose Parkinson's disease, to help treat the symptoms of Parkinson's disease, and to help with the progression of the disease itself. We will first review very briefly, because you've been hearing about it all morning, the diagnosis of Parkinson's disease. And then we will go over some of the available technology that we currently have out there. What I will be talking about is not a clinical recommendation. So I will make examples of apps, I will make examples of devices, but it doesn't mean that I endorse those devices or that I recommend you use those devices. So you'll see different kinds of, a whole bunch of different devices, watches or balls or things like that. It doesn't mean that I want you to buy it or I want you to use it. We'll go over their impact in your care and to discuss the scientific evidence behind it. Is it worth buying these devices? Is it worth using these devices? Parkinson's disease is a rare condition, but it's affecting approximately 1 million people in the US as of today, more than 10 million all over the world. And the incidence and prevalence are increasing, are on the rise, meaning the number of people who develop Parkinson's disease on a yearly basis is increasing, and the number of patients who have been diagnosed with Parkinson's disease in the general population over a year time also is increasing, has increased, it is increasing, and it affects male more than females, has a slight predominance for male. But Parkinson's disease is a very complex disease. You know it by now, you've seen it today all day. There are many pieces to this big and complicated puzzle. Simplistically, almost simplistically speaking, we can differentiate between two big categories: the motor symptoms of Parkinson's disease and the non-motor symptoms of Parkinson's disease. The motor symptoms of Parkinson's disease is what we use to make the diagnosis. So you have to have what we call bradykinesia, which is just a fancy term, a fancy word to say slowing of the movements. And on top of that, you may also have some tremor, specific kind of tremor. It's called a resting tremor, and then rigidity, assessed by slow, passive movement of the major joints. But on top of that, on top of these motor symptoms, which may be more apparent, more visible to you, there is also a constellation of other symptoms, which may be more difficult to assess, more difficult to discern, but not because of that, not less troublesome than the motor symptoms. A lot of my patients come to me and they complain of fatigue. They complain of sleep problems, insomnia, dream and acting behavior, acting out their dreams, constipation. Constipation is very common as well, or a decrease or lack of sense of smell. And then we also have mood changes, which are very common: depression, anxiety, which can start even years before the onset of the motor symptoms. And then the cognition can be affected as well. And the list goes on and on and on. I put here only few of them. But how do we measure these symptoms? How do we assess? How do we make the diagnosis? How do we assess these symptoms? How do we follow you over time? What we do right now is mainly based on a clinical monitoring. What we use is something called the MDS, or Movement Disorder Society UPDRS score. It's a score that is made out of 4 different parts. The motor part of it is MDS UPDRS part 3. And you're probably familiar with it. If I tell you what it is, you probably know what it is, because if you come to our clinic, you're probably familiar with us asking you to tap your fingers like this, or open and closing your hands, right? Exactly. Yeah, just like that. Or we watch you walk in the hallway, or we watch you and assess for tremor, for instance. And for each of those items, we give you a score. And at the end of it, we give you we sum up these numbers, and we give you a score for this MDS UPDRS. The lower the score, the better it is, meaning the milder the symptoms are. And this is great. This is our gold standard. This is what we do. And there's a problem with this, or there are few little problems with this one. One problem is that you have to come to me for me to perform this scoring system, right? So you have to leave your house, you have to get on the train, get on your car, get on your airplane, and come here, see me, which is not easy. You have to find me. You have to go potentially to a tertiary care center to find a movement disorder specialist who's supposed to be performing this test. The other problem with you being in the office is that we only have a limited amount of time available. So I can see you for 30 minutes, 60 minutes, 90 minutes, whatever you want, but that's still not enough, meaning that represents only a snapshot of what goes on in your everyday life. So we have to put everything together in those 60 minutes, and those 60 minutes may not be a good representation of what happens at home for, I don't know, the next 6 months till our next appointment, for instance. Also, and this is true for Parkinson's disease patients, but it's also true in general in medicine, there is what we call a performance bias, meaning patients usually tend to perform better when they know they are being seen and when they come to the office. So if you, for instance, do this at home and then you do it in front of me in the office, you'll probably do better in front of me in the office, right? But so we know that that's a fact, but I'm making recommendations and assessing your response to the medication based on what I see in the office, not what I see at home. And also during those 60-ish minutes, it may be difficult also to assess symptoms that are a little bit more rare, falls, frequency of falls, tendency to falls, symptoms that have a fluctuating pattern. So by nature, they may not be present in that moment, such as dyskinesias or symptoms that may be present at night. Insomnia, dream and acting behavior, and so forth. So we had to find a way to assess these symptoms, to monitor these symptoms, and to almost come to you, to your house, rather than you having to find me and come to us. That is the focus behind the idea of starting a remote monitoring or having a remote monitoring for Parkinson's disease. A remote monitoring approach may or will help us ideally have an evaluation in an unsupervised environment, such as your home, which again avoids the need for you to having to come to me. Remember, Parkinson's disease is a disorder that affects the motor system predominantly, and I'm asking you to get in the car, drive in traffic, come to me, go up X number of flight of stairs. We have to get rid of that, right? It's not easy. It's very complicated. Having a remote monitoring also may help us and will help us have longer evaluation. So instead of me making my judgment based on a snapshot, I can assess your symptoms, your disease, your progression, your response to the therapy based on information that we've been gathering for 24 hours, 1 week, 1 month, 6 months, you name it. And also it's an objective observation, meaning it's not just me telling you this is what it is, it's actually based on numbers. Another caveat of the scoring system that I was talking to you about earlier, the MDS-UPDRS, is that it is somewhat subjective, meaning there can be some variability in the numbers in the scoring system. If Dr. Hall and I assess the same patient 5 minutes apart, the numbers that we give you may be slightly different. It's not just because she's better than me, okay? Just don't say that. Don't. I know you're thinking that, but don't say that, okay? It is true. But because it's just the nature of things, right? So we need a reliable source of information to assess your symptoms. And if you think about it, what we're doing in the field of Parkinson's disease is basically just catching up with what has been done already in medicine in other subspecialties. You're probably familiar with a glucose monitoring device, right? So what you do is basically you record your blood glucose levels at home. You don't need to go to the doctor. You can do it every day. You can do it continuously if you have diabetes. Or in the field of cardiology, you can do it with a Holter monitor for heart rate or blood pressure, meaning you can record your heart rate or your blood pressure for 24 hours, 7 days, a month, you name it, and then provide that information to your doctor. So that's what we're trying to do with Parkinson's disease as well. But how can we manufacture an ideal device? What should an ideal device help us with? Well, first of all, it should help us make the diagnosis of Parkinson's disease. We're not quite there yet, but ideally it should help us make the diagnosis and differentiate Parkinson's disease from other disorders that may be similar or look like Parkinson's disease. As of now, what we can do is we can measure symptoms. We can assess your symptoms, we can measure them, we can help with the treatment, and we can monitor the progression of the disease and your response to the treatment. That's what an ideal device should do, and that's for the majority of it also what we currently have available in terms of technology. And how do we do that? Well, the first question is, what are we going to measure? Okay, so we have a device. What are we going to do with this device? What kind of symptoms are we going to measure? The devices that are currently available and marketed, not only in the US, but all over the world, only focus on a specific subset of symptoms. So there's no device right now that takes into consideration the whole constellation of symptoms of Parkinson's disease. There's a device or X number of devices that focus on tremor, bradykinesia, rigidity, other devices that focus on sleep problems, other devices that focus on dyskinesia. That's a limiting factor. That is unfortunately a limiting factor, and we're working on that. But also, just as importantly, these symptoms that we are measuring, so whatever we are measuring should be clinically relevant. A possible problem or complication of this technology is that we're going to have a plethora of information, a lot of information that may not be clinically relevant, or we may be overdiagnosing something that it's not really important. Where are we measuring these symptoms? Where do we put the sensors? The majority of the devices that I'll show you use, just like your watch, for instance, your Apple Watch or your Fitbit, they use accelerometer and gyroscopes. But where you put them on your body also is important. And that depends also on your symptoms. If you have tremor, and the tremor affects your left hand more so than on the right, it makes sense to put the device on your left wrist, for instance, or in your left hand. But what if you have symptoms on both sides? Or what if you have symptoms at what we call axial or midline symptoms? What if your main problem is not tremor, but is, for instance, your gait, your walk, your ability to walk properly, or your falls, the number of falls, the risk of falling? So the location of the sensors affects the symptoms that we're going to assess and potentially also the treatment. How do we measure these symptoms? It's also important. It may between the question between measuring and monitoring your symptoms periodically or continuously. If I ask you which one you want, well, continuously, it's better. Well, if we actually look at it from a scientific standpoint, it hasn't been proven that that's actually true. So if you put a periodic monitoring versus a continuous monitor, the clinical benefit that patients have is not obvious. Also, with the continuous monitor, again, we go back to the problem that I discussed earlier, that we have a lot of information, or we may have a lot of information and we may not know what to do with it, or we may have information that is not clinically relevant or clinically valued, that it's not going to change the way we practice medicine. It's not going to change the way we treat your symptoms and we try and make your life and your quality of life better. And then, obviously, this should go without saying, should being the key word here, whatever we're measuring, wherever we are measuring it, and however we are measuring it, it should be visually intuitive, or in other terms, user-friendly, right? It's probably the most important thing, what we care about, especially when it comes to marketing things. And speaking of marketing, the first few points we already reviewed. All this information that we are able to collect, it comes at a cost. Who's paying for this? Who's paying for the device? Who's paying for the app? Is it covered by Medicare? Is it covered by your insurance? Is it out of pocket? This is all valuable information that we have to focus on before we make the decision of purchasing something or using a particular device. I mentioned earlier the importance of the location of the sensors based on your symptoms. Now, if I ask you which one of these two devices you would rather use, the answer is obvious. Between a whole body suit and a device that is this small, it's a little bit bigger than a dime, it makes sense that you choose you may choose the whole body suit, right? Right. So we're on the same page. No, obviously you would choose the one on the right. But if you think about it, the whole body suit is able to record much more information from different areas of the body, and it may create a better picture of your symptoms, a better picture of your disease, and it may help me and you more than a small device like this. And we'll talk about this device a little bit later. So this is important. The choice of the device based on your symptoms and the location where you put that device on is very important. We're very good at measuring tremor with these devices, really good at measuring tremor. We're also good at measuring other symptoms, but tremor is probably the best one. We're good at measuring bradykinesia, which is, again, the slowing of the movements, dyskinesias, on and off period. So when it comes to therapy, we're really good at measuring it. If you're in your on period, you're probably all familiar with what that means, meaning after you took the medication has kicked in and you feel better, meaning your Parkinsonian symptoms improve, compared to your off times or off periods when the effect of the medication wears off and your symptoms come back out. We're also pretty good at measuring information regarding your sleep or gait, falls, frequency of falls, but also the risk of falling. And how do we do that? Let's start talking. Let's get to the juice of this discussion, which is to go over some of these devices. I would like to break this down into three different points. The first point is to talk about a couple of devices, actual devices that have been manufactured to help diagnosing, to help with symptom assessment and therapy response. We'll then talk about those devices that are actually out there to help you with the treatment. So devices that help with therapy. And then we'll talk about apps, smartphone apps. So not an actual device, but an app that you can download on your device. Again, these are just examples. These are not clinical recommendations, but this is probably one of the most frequently used and commonly used, at least when it comes to research, because this is only available for research purposes right now. It's called the PKG, or personal kinetic graph. It's a watch. It's also a nice watch, easy to wear, nice. It's really good diagnosing and assessing tremor, dyskinesia, bradykinesia with a really high sensitivity. With the problem, though, that it may actually overdiagnose these symptoms, so we need to be a little bit careful about that. We need more research on that. But what's also as important, or potentially even more important, that not also is this watch is pretty good at diagnosing or assessing these symptoms, but it's good because it's clinically relevant. The information that this watch gives us has been able to has led to changes in the way physicians have managed patients who will be using this watch in 80% of the cases. So that's a lot. This is only based on a small trial, few people. When I say few, I mean 15 people, 15. So obviously very limited data, but obviously the manufacturer is very excited about this device, as they should, and as we all are. So we're looking forward to seeing more information about this. Again, one caveat about this watch is that it's really good at picking up some of the symptoms. Remember, you wear on your wrist. It's a watch. So intuitively, it may help assess tremor, bradykinesia, dyskinesia. But what about if my major issue is that I can't sleep at night, or if my major issue is that my gait is not as good as it used to be and I fall really often? The location of this device doesn't really help me with that. So that's really important. For that reason, the second device that I wanted to discuss with you is it's the Staton device, a little bit bigger, you see it, but it's worn on your waist. So it's not a watch anymore. It's a small rectangular device that you wear on your waist. Because of the location of the sensor, it's really good at picking up symptoms that are more midline, more axial symptoms. So conversely to the prior one, this is really good at picking up information about your gait, your risk of falling, your potential freezing of gait, bradykinesia, slowing of the movements. The problem with this, so go ahead. It's mainly based on AI. So it's based on your gait. It measures the stride length, the stability of your steps, the oscillation, the lateral oscillations when you walk. And then you also have to input some data. We'll see later on that a lot of these devices actually require you to input a lot of data in it. And so with a combination of this information, they're able to assess the risk of falling for each particular individual.
Correct. Patient trying to get a base. Some of these measures, that'd be a burden.
It is. And you brought up a very good point, which is possibly part of the reason why, when it was actually studied in patients, although ideally it's a great device, it hasn't led to many changes in the management of these patients. So it may give a lot of information, but we don't know if that information is actually accurate. Great point. Thank you. The next step was to, as I said earlier, was to discuss a little bit more about those devices that can actually not just assess your symptoms and track your symptoms over time, but just as importantly, treat some of those symptoms. And the majority of these cueing devices take advantage of sensory stimulation and sensory cueing, vibration or sensory cue, vibratory cue, visual cue, auditory cue, and so forth. And so we'll review some of them, at least the most commonly used ones. On the far left of the screen, you see the very first one, the Calatrio device. This is available. It's actually FDA approved for essential tremor, but we can use it also in Parkinson's disease because it's really good at picking up tremor and really good potentially at treating the tremor. It looks like a watch, but it's actually more of a bracelet. You wear it on your most affected side, obviously. And what it does is it creates an electrical stimulation. So whenever the device receives notices that the trembling of the hand, it produces an electrical stimulation that travels all the way up to the brain and interferes with the software in the brain to help reprogram it and lower the tremor. The electrical stimulation is very small, it's very light, obviously it's not painful, because one of the most important features about these particular devices, you'll see at the bottom of each of these columns, is that they're safe. And that's really important, they're safe. So not only they may help you with your symptoms, but they're also safe. If they don't work, you don't need to use them, and you haven't done any damage to yourself. The company, the manufacturer for this device, the Calatrio, reports 50% improvement in the tremor in 50% of the patients. Now, if you ask for my opinion, it's not that high. It's not 50%, but I've had patients for whom it's been very, very helpful. So this is definitely a possibility. When it comes to cost, I put here a big question mark, because when it was initially FDA approved, it was initially covered by insurance, then it wasn't anymore, but it was covered by Medicare, and then Medicare didn't want to cover for it anymore, and so the manufacturer decided to basically sponsor I don't remember if it was a 3 or 6 month free trial, so you could use it for that period of time. If it didn't work, you can send it back at no cost. Now they're not doing it anymore. I think now it's out of pocket. So big question mark when it comes to cost. Yes, Julie, is that right? Yeah. Sarah, go ahead. So this is mainly for treatment rather than detection. So it detects, by detecting the tremor and creating this electrical impulse, it's actually helping you with the treatment. It doesn't give you information about the tremor itself. No. That's why the location of the sensor is so important. The second one is called the Q1 device. This is the device that I showed you earlier, slightly bigger than a dime. In this case, it's actually put on your chest, and it's a vibratory cue. So similar technology compared to the Calatrio, but instead of being an electrical impulse, it's actually a vibration that is given to you whenever it perceives the tremor. And again, it acts by reprogramming your tremor and improving your tremor. Right now, it is seeking FDA approval in the States. It is approved in the UK, approximately $400. So we are on the lookout for that. The third one, this is actually something that Dr. Getz discussed with you earlier this morning. And he is actually the one who told me about this ball. I didn't know about this one. And he showed up to my office one day and was like, hey, one of my patients came with this ball in his hands. Do you know about it? And I said, no. So better read about it. And it's called Villain Ball. It's actually very nice. It's a very nice technology. Again, it takes advantage of a vibratory stimulation, a vibratory cue. And the company itself, so whenever you have tremor, you can use this ball. It vibrates in your hand. The manufacturer says that if you use it for 10 minutes, it can improve your tremor for up to 4 hours. The feedback that I had from that particular patient, again, only one patient, but the feedback that I had, he uses it on a as needed basis. If he has to go to the bank, for instance, he holds it for 1 hour or so prior to as he's walking to the bank, for instance, and then he's able to sign his name. It improves his tremor. It lasts approximately 1 hour or so, according to this single report, and then the tremor comes back. But it can be a useful as needed kind of rescue medication. It is a little bit pricey, around $500. It's not crazy expensive though. So if it works, it may be worth it, but obviously, I don't have a lot of experience with this one, but again, it's safe. And then the last one is a slightly different device. Again, we reviewed primarily sensory cueing devices. So a vibratory device, a couple of vibratory devices, an electrical stimulation. This is a visual cue. And this is relevant for those patients. I wanted to put here something relevant for those patients that maybe don't have a lot of tremor, don't have a lot of slowing of the movements, but they have problems with their gait. They have something called freezing of gait. So small steps, they can't move forward. The upper side of the body moves forward, and that can lead to falls, but the feet are stuck to the ground. Patients tell me that they're glued to the ground. There's this device, it's called U-Step. It's approximately $200, and you can actually attach it on the cane, and it projects using a laser beam. It projects a line on the floor. It forces patients to think about what they're doing, to think about their step. This is mimicking something that I, without knowing about this, I actually do with my patients routinely in the office. I always tell them, either I put my foot in front of them and I tell them, step over my foot. So I put my foot over them and I tell them, step over my foot, okay, when you're freezing. Or if you are in an episode of freezing, I tell them, consciously think about it and take a big step. Imagine that you're stepping over an actual step, like a stair step, okay? And that's basically what this device is doing. So it's forcing to consciously think about it, and it overcomes the freezing of gait. Smartphone apps. Now, we reviewed devices that can help assess and track symptoms in Parkinson's disease. We reviewed some of the devices that can help with treating some of the symptoms in Parkinson's disease. And now the big field of the apps that can be downloaded on your app or on your watch. In preparation for this presentation, I typed on my phone, on my what is it called? The App Store. Okay, sorry. On my App Store, I typed Parkinson, and these icons, these apps showed up. And this is just a small subset of that list. The list keeps going on and on and on. Eventually, I got tired of reporting them all because there are so many. The majority of them are actually free or are very little cost. And there's really none that is better than the other. But how do they work? So ideally, what we would expect from these apps is that you download them on your device, either your phone or your watch or whatever you use. You input some of your personal data. The device tracks the symptoms over time. It creates a report that then your doctor can use to help with the therapy and to help clinically and provide a clinical benefit. So I actually downloaded one of these apps myself. I was like, okay, well, I've been talking about this with my patients for a very long time. I wanna see how they actually work. And so I noticed that initially you had to input a lot of information. A lot of what you do with these apps is it's basically a diary report. So when one of these apps, the first thing that shows up is right here. I don't know if you see my cursor here, is it basically asks you, how are you feeling today? How are your symptoms today? And you're, I don't have any symptoms, or my symptoms are mild, moderate, severe, and you do it on a daily basis, and then it tracks them out, and it gives you a monthly report. You see here on the right. And you can also input a lot of other information about your drug schedule, timing of the medication. They're good reminders to take the medication. You can input information about physical activity, your mood, or your sleep pattern. But it's a lot of work. You have to do it. You have to input this information. And when it actually comes to the information recorded by the device rather than something that you input in the device, it's not the app. If you think about it, it's not the app that does it. The app is the interface that particular company created between you and the device. But it's the device itself that, by the use of the accelerometer or the gyroscope or whatever technology they use, they assess your symptoms and they track your symptoms. They can then log them out here, and they tell you over X period of time, you have had X hours of tremor. Your tremor is worse in this particular time of the day. They can compare it with the timing of the medication. So it's very useful. And at the end of it, they give a report to your doctor, and based on that report, then your doctor can make decisions of changing the medication or in general assessing your symptomatology. Again, not over a snapshot, not over those 60 minutes, but over a longer period of time. So this is actually very helpful, maybe very helpful if used in the right way, because remember, it has to be clinically relevant. Yes, sir.
I have stride feeding,
Okay.
and it tells me that I have 7 minutes of primer and 23 minutes. And I don't know when I have those. No. So it does, there is a disclaimer that it might just overdo it. Like,
So exactly. So remember earlier we discussed about the importance of what to measure, right? What are we measuring it? And also whatever we are measuring has to be clinically relevant. The goal is not to overdiagnose. What's happening potentially, I don't know your clinical history, but what's happening potentially is that the watch is, number one, we have to assume that those measurements are correct, right? And that's a big problem. So we have to assume that really you have tremor and really you have dyskinesias. Let's say that is correct and you do have them. Then the next question becomes, are they relevant to you? Are they relevant to your care? Or is the app or is the device overdiagnosing me, giving me too much information, right? So that's a great point. That's exactly what one of the points that I want to hit in this discussion. Thank you for sharing that.
yeah, sometimes you don't have watch.
That's what I said. We have to assume that that's right. But there is a great point, sir, because my last point here, my last bullet point on this slide, I'll jump to it, is the lack of standardized protocol. There is a problem because all these companies, all these app developers, they obviously are fighting with each other. They rarely, if ever, compare their reports and their information to the gold standard, which is a clinical evaluation. And so it is possible that, just to make it easy, make it a little bit easier to understand, is it possible that if you download a different app from a different manufacturer, it can give you different information because there's no gold standard, and you don't know which one is which. You don't know which one is true or correct. That's a big problem. It's a big problem because the commercialization of these apps has gone way ahead of the scientific evidence that we actually have, and we potentially run into that problem of overdiagnosing or giving information that is not clinically relevant. I'm not doing anything with those 3 minutes of tremor that you may have. Am I going to change the way I treat you because of those 3 minutes of tremor? Maybe, but maybe not. And so, in conclusion, this is a great technology. This is a great technology. I'm very excited that we are moving forward with this. But we have to ask ourselves the right questions. We have to make sure that we know what we are measuring what we're measuring. I'm sorry, because of this risk that we were just discussing about. We have to know where we are measuring. So X device doesn't and cannot work for everybody. Ideally, yes. Ideally, you may wear the whole body suit that I showed you earlier, right? But ideally, the goal is to have a device, for instance, worn on your wrist, like a watch, that can actually give you information on all your symptoms, not just the information that is coming from your left wrist or your left hand. But it's also important to emphasize something at the end of this discussion, which is the discussion. Sorry for the repetition. That always has to happen with your doctor. The information that you receive from the device may be very valuable information, but you also always have to try and integrate this information with your provider. Because at the end of the day, our goal is to make your life better, make your life easier. And if there is a device that can help us do that, great. It's welcome, but we have to work together towards it. Thank you all for coming here. Any additional questions? Yes.
Is there any other sensory type devices that then connect to the iPhone that you have?
Yes, I only showed few of them to give a kind of an overview, but there are many other queuing devices. That's what you're referring to, right? The queuing devices. There are many more visual visual queuing systems other than the laser beam that I showed you. There are auditory devices, for instance, in patients with again Parkinson's disease with freezing of gait. Just to make it easy, it kind of like gives you a beep or a sound, and that triggers you to having to think about the movement, and it can help with the freezing of gait. So there are a lot of different cueing stimuli that can be used